Think about this for a moment. You get a simple cut on your finger. A small infection starts. You go to the doctor. You take antibiotics. But this time, the medicine doesn't work. The infection spreads. It gets worse. And suddenly, something small becomes life-threatening. This is not science fiction. This is happening right now. Around the world, tiny organisms, bacteria, viruses, fungi, and parasites are learning how to survive the medicines designed to kill them. This growing crisis is called antimicrobial resistance, often shortened to AMR. It is sometimes described as a slow pandemic. Not loud, not dramatic, but deeply dangerous. Over the next few moments, we explore this invisible war and the people fighting to protect our future. In simple terms, antimicrobials are medicines that kill germs. The most famous type is antibiotics, drugs used to treat bacterial infections. For decades, antibiotics have saved millions of lives. Before they existed, simple infections could kill. A scratch from a rose thorn, a sore throat, childbirth. Then antibiotics arrived, and medicine changed forever. But here's the problem. Germs are alive, and living things adapt. When antibiotics are used, most bacteria die, but sometimes a few survive. These survivors are stronger, resistant. They multiply. They pass on their strength. Soon, the medicine that once worked no longer does. That is antimicrobial resistance. And when bacteria become resistant, we sometimes call them superbugs. Not because they are monsters, but because they survive what used to destroy them. This happens more often than you might think. In 2019 alone, more than 1 million people died directly because of drug-resistant infections worldwide. Millions more deaths were linked to resistant infections. That's more than many well-known diseases. In some countries, common infections, like urinary tract infections, are becoming harder to treat. In hospitals, doctors are seeing cases where several antibiotics must be tried before one works. Some infections no longer respond to the most common drugs at all. And this affects everyone: children, elderly patients, cancer patients, people having surgery, women giving birth. Modern medicine depends on antibiotics. Without them, even routine medical procedures become risky. Here's an important point. Resistance is natural. Bacteria have been adapting for billions of years, but human behavior has sped it up. Here's how. Overuse of antibiotics. Sometimes antibiotics are given for illnesses they cannot treat, like colds or flu, which are caused by viruses. Antibiotics do not kill viruses, but if taken unnecessarily, they still expose bacteria in the body to the drug, giving them a chance to adapt. Not finishing prescriptions. When people stop taking antibiotics early, some bacteria survive. Those survivors may become resistant. Use in farming. In many parts of the world, antibiotics are used in animals to prevent disease or promote growth. This can also contribute to resistant bacteria developing. Poor sanitation and infection control. When hygiene systems are weak, resistant germs spread more easily. This is a global issue, not an individual mistake. It's a global pattern, and it requires a global response. Every number represents a real person. A child whose infection doesn't respond. A mother who stays in hospital longer than expected. An elderly patient who needs stronger, more toxic medicine. Doctors sometimes describe the fear of watching an infection grow, while waiting for lab results to show which antibiotic might still work. Families describe frustration and confusion. How can a simple infection be so serious? Because the medicine is failing. This isn't about blame. It's about awareness. And it's about protecting people, especially the most vulnerable. While resistant germs are spreading, so are efforts to stop them. Across the world, scientists are studying bacteria under microscopes, mapping their genetic changes. Doctors are carefully prescribing antibiotics, only when needed. Hospitals are strengthening hygiene practices, improving hand-washing systems, and infection control. Public health workers are educating communities about when antibiotics are helpful and when they are not. There are also researchers working tirelessly to develop new antibiotics. This work is difficult and expensive. Bacteria evolve quickly. Developing new drugs takes years, yet they continue. These researchers, nurses, pharmacists, and doctors are fighting an invisible enemy every day, often without headlines, often without recognition. But their work saves lives. The good news? We are not powerless. There are clear actions that help. Only using antibiotics when prescribed by a qualified health professional. Finishing the full course of treatment. Never sharing antibiotics with others. Preventing infections through hygiene, hand washing, safe food handling, vaccination. Supporting policies that reduce unnecessary antibiotic use in farming. Governments and global organizations are also working together to monitor resistant infections and improve access to clean water and healthcare systems. Prevention is powerful. Every infection avoided is one less opportunity for resistance to grow. Experts warn that if resistance continues to grow unchecked, by 2050, millions more lives could be lost each year. Cancer treatments could become riskier. Organ transplants could become more dangerous. Simple surgeries could carry deadly complications. We could slowly return to a time before antibiotics, when minor injuries were life-threatening. But this future is not guaranteed. What happens next is up to us. The crisis is silent, but its impact is massive. It doesn't dominate headlines daily, but it is one of the most serious health threats of our time. The story of antibiotics was once one of the greatest victories in medical history. Now, we face a new chapter, a test of wisdom, a test of responsibility, a test of global cooperation. The enemy is microscopic, but the solution is collective. Doctors, scientists, farmers, governments, families, and you. This is not a story of fear. It is a story of awareness. Because when humanity understands a problem, we are capable of extraordinary solutions. And this fight for our future, it's not too late.